Those dignitaries, those who are outside the hall, they are requested to come inside. We are going to start the program within few minutes. जो लोग बाहर है उनसे विनती है कि आप हॉल में पधारिए. कार्यक्रम बहुत जल्दी शुरू होने वाला है. So we are here for Pharma National Pharma Summit 2025. I am requesting all the dignitaries which are outside the hall, please come inside. I am requesting all the dignitaries to take their seats, please. All the dignitaries and Pharma Look team members, you are requested to come inside. We are already too late. Pharma Look team members, you are requested to take your seats, please. मैं आपकी क्षमा चाहता हूं कि हमने प्रोग्राम थोड़ा सा लेट शुरू हुआ है. तो I oblige that we are going to start the program with a late schedule. All the dignitaries are requested to take their seats, please. Pharma Look National Pharma Summit 2025. Good morning, ladies and gentlemen. A very warm welcome to each one of you to the grand inaugural ceremony of Pharma Look National Pharma Summit 2025. The theme of the summit is transforming pharmacy institutions, advancing education, fostering research, and serving public health. It's a confluence of knowledge, innovation, and collaboration in the field of pharmacy. Today, under one roof, we have gathered the brightest minds, researchers, academicians, policymakers, industry leads, and passionate students. to discuss and deliberate and design the future of pharmaceutical sector of India. To begin this auspicious event, may I request all our esteemed dignitaries to kindly come forward and for the lighting of the lamp for the inaugural ceremony. Please, instead of calling each name, I am inviting all the dignitaries to come forward for lighting the lamp. Lighting the lamp is a symbol of knowledge, enlightenment, and progress. So all dignitaries are requested to come forward, please. Sir, please. All dignitaries, please come forward. Ladies and gentlemen, let's rise and welcome this moment of positivity and prosperity with big round of applause. So this is an inauguration of Pharma National Pharma Summit 2025. Ladies and gentlemen, please give a big round of applause. So this is a positivity. This is what the pharmacy profession is growing day by day. Pharma is an organization who is always taking initiatives for the betterment of pharmacy profession. So it's a pleasure to us that all the dignitaries in the pharmacy profession in India, they are so these are the expertise. Thank you all. Thank you. Now it's time to inaugurate this ceremony with Saraswati Vandana, which is going to be carried by Shruti, Archita, Akanksha, students from Sai School of Pharmaceutical Education and Research, Sai University, Palampur, Himachal Pradesh. So I request the students be ready for Saraswati Vandana. So this is an inauguration of Pharma National Pharma Summit 2025. Thank you all the dignitaries. So I request all the students for Saraswati Vandana. Please. Thank you. Now it's my privilege to felicitate all the guests of honors by floral bouquet. So I request all the Pharma team members, Santosh Verma sir, Saurabh Kose sir, and Amit Jha sir. Please come forward. So this is the time to felicitate all the dignitaries, those contributing in the pharmacy profession in India. So I request all the dignitaries to come forward. First, there is most respected Dr. Santani sir. Dr. Santani sir, you are requested to come forward. So give a big round of applause. Professor R.K. Khar sir. Professor R.K. Khar sir, one of the eminent personality in pharmacy profession. Dr. Atul Nasa sir. जोरदार तालियां बजनी चाहिए. The man who is contributing in the field of pharmacy profession since so many years. Dr. Bhupinder Singh Bhoop sir. Dr. O.P. Tiwari sir, please. Dr. Kanchan Kohli, Dr. S.K. Panda, Dr. S.K. Panda sir, please. Dr. Satish Sharma sir. तालियां की आवाज नहीं आ रही है आपकी. तालियां की आवाज इतनी चाहिए कि दिल्ली घूमनी चाहिए. डॉक्टर अनिल शर्मा सर. So these are all the pillars of pharmacy profession in India. Professor Navendra Ahuja sir. Professor Mahesh Prasad sir. Professor Mahesh Prasad sir. Dr. Ashutosh Mishra sir. G.D. Gupta sir, please. Professor G.D. Gupta sir. Professor G.D. Gupta sir, please. So these are all the mentors of Pharma Log, always guiding for the various upbringing things in the Pharma Log team. Professor Arun Garg sir, next. Professor Arun sir, nahi. Professor Sanjay Jachak, Dr. Rajendra Guleria sir, Professor B. Mishra sir, Dr. Seema Kohli, Professor Mahendra Singh Ashawat sir, Dr. Jay Balan sir, please. Dr. Ankur Agarwal sir, please. Dr. Boop sir, please. Boop sir, you are requested. So have a big round of applause, Boop sir. Boop sir is entered in the premises now, please. Saranjit sir, so he is entered now. So sir, welcome and give him a big round of applause. So I request Saranjit sir. Saranjit sir, please. Dr. Goyal ma'am. Dr. Goyal ma'am, please. Dr. Richa Dayaramani ma'am, please. Dr. Rakesh Shomani sir, please. Dr. Goyal ma'am, please. हाँ सर मुझे बताओ ना डॉक्टर हयात मुख्तार सर डॉक्टर हयात मुख्तार सर डॉक्टर राकेश सोमानी सर प्रेसिडेंट एपीटीआई महाराष्ट्र हयात मुख्तार सर प्लीज आवाज कम हो गई है तालियों की आवाज बजती रहनी चाहिए कंटिन्यूअसली बिकॉज दीज आर ऑल द पिलर्स ऑफ फार्मेसी प्रोफेशन इन इंडिया डॉक्टर राकेश सोमानी सर प्लीज सो वन ऑफ द डायनेमिक पर्सनालिटी इन महाराष्ट्र डॉक्टर राकेश सोमानी डॉक्टर आशीष बाल्दी नहीं है डॉक्टर शैलेश शर्मा सर डायरेक्टर सीओपी डॉक्टर विनय विनय चावला सर, डॉक्टर ए बाबू, बाबू सर प्लीज, डॉक्टर अरुण गुप्ता है क्या नहीं है, ए बाबू सर प्लीज, मुझे बताते रहो जरा आगे। हाँ है, अभी उनका ही नाम ले रहा हूँ। डॉक्टर अमित चौधरी सर, डॉक्टर अमित चौधरी सर प्लीज, डॉक्टर राज वैद्य, डॉक्टर सौरभ शर्मा, डॉक्टर कमला पाठक मैम, डॉक्टर प्रोफेसर राम रॉय नहीं है, हो गया, डॉक्टर गिरिराज कुलकर्णी नहीं है, प्रोफेसर वर्मा राम, प्रोफेसर जाहिद अली, हाँ डॉक्टर आलोक मुखर्जी सर प्लीज, हाँ वही बताओ मुझे कोई, क्या मैं चेहरे कुछ पहचानता नहीं ना, डॉक्टर आलोक मुखर्जी सर प्लीज, देखो कोई रहा नहीं ना, डॉक्टर हितेश सरनेम क्या है, डॉक्टर हितेश सर, हितेश दवेजा सर, और डॉक्टर कुमार गौरव सर प्लीज, डॉक्टर राकेश पटेल सर, डॉक्टर कुमार गौरव एंड डॉक्टर राकेश पटेल सर प्लीज, डॉक्टर गीता मैम, डॉक्टर मिलिंद पांडे सर प्लीज, डॉक्टर गीता मैम, डॉक्टर मिलिंद पांडे सर प्लीज, कोई रहा है क्या, कोई रहा नहीं ना सर, Thank you all the dignitaries and guests of honor. So, ladies and gentlemen, please give a big round of applause for all these dignitaries. These are the pillars of Pharma. To set a tone of the summit, may I now invite Dr. Santosh Kumar Verma sir, convener of Pharma, for the welcome address. Please, sir.
सर्वप्रथम मैं मां शारदे के चरणों में अपने भक्तिभाव के श्रद्धा सुमन अर्पित करता हूं और साथ ही हमारे मां शारदे के वरद पुत्र प्रोफेसर महादेवलाल श्रॉफ सर के श्री कमलों में शीश नवाते हुए इस कार्यक्रम की शुरुआत करने की अनुमति चाहता हूं। सर्वप्रथम respected dignitaries, honored guests, esteemed speakers and dear colleague, student and friends, especially our mentors, because without blessing of him, we are not going to succeed or proceed this summit. Especially for the chairman of this National Pharma Summit 2025, Chairman Professor Dev Das Santani sir and Co-Chairman Professor J. Govind Swami sir. Again, ये मेरे लिए अत्यंत हर्ष और गर्व का विषय है कि मैं आप सभी का राष्ट्रीय फार्मा समिट 2025 दिल्ली में हार्दिक स्वागत करता हूं। इस प्रतिष्ठित आयोजन का संयोजन करने के नाते मैं आप सभी की आस्था, सहयोग और उत्साह के लिए आभारी हूं, जिसने इस आयोजन को सफल बनाने में अहम भूमिका निभाई है। इस वर्ष का समिट का विषय फार्मेसी संस्थानों का रूपांतरण, शिक्षा, अनुसंधान, जन स्वास्थ्य की सेवा को बढ़ावा देना है। समाज में फार्मेसी की भूमिका को पुनर्परिभाषित करने की हमारी प्रतिबद्धता है। फार्मा लोग का आदर्श वाक्य है, फार्मेसी में नवाचार, जीवन पर्यंत शिक्षा और जन कल्याण को समर्पित एक जीवंत समुदाय का निर्माण करना। फार्मा लोग का विजन है कि फार्मेसी क्षेत्र में परिवर्तनकारी मंच बनना, स्वास्थ्य पेशेवरों की अगली पीढ़ी को पोषित करना, अकादमिक शिक्षा और व्यवहारिक स्वास्थ्य देखभाल के बीच की दूरी मिटाना और फार्मेसी शिक्षा एवं सेवा में विश्वास, उत्कृष्टता एवं प्रगति का राष्ट्रीय प्रतीक बनना। फार्मा लोग का मिशन है कि विद्यार्थियों और पेशेवरों को व्यवहारिक कौशल, ज्ञान और सामुदायिक स्वास्थ्य के प्रति उत्तरदायित्व के साथ तैयार करना। इस सिद्धांत और व्यवहार के बीच की खाई को पाटने, सतत शिक्षा को प्रोत्साहित करने और कुशल, संवेदनशील एवं वैश्विक जागरूक फार्मेसी कार्यबल का निर्माण करने पर केंद्रित है। फार्मा लोग की नियमित रूप से पैनल चर्चा, विशेषज्ञ व्याख्यान, वेबिनार, सम्मेलन, मेंटरिंग कार्यक्रमों और सामाजिक जागरूकता जैसी गतिविधियों का आयोजन करना है, जिससे फार्मेसी के विद्यार्थियों, शिक्षकों और पेशेवरों के बीच में नेतृत्व एवं नवाचार को प्रोत्साहन मिले। आज हम फार्मेसी शिक्षा के जनक प्रोफेसर महादेवलाल श्रॉफ सर को सच्ची श्रद्धांजलि अर्पित करते हैं। प्रोफेसर श्रॉफ ने देश में संगठित फार्मेसी शिक्षा की नींव रखी, बनारस हिंदू विश्वविद्यालय के विभाग की स्थापना की और अनेक पीढ़ियों को उत्कृष्टता, नवाचार और नैतिकता की दिशा में प्रेरित किया। उनके कार्यों के कारण ही आज का जीवंत और प्रगतिशील फार्मेसी क्षेत्र में अस्तित्व बना है। आइए हम उनके योगदान का सम्मान करते हुए ईमानदारी, नवाचार और सेवा के लिए स्वयं को समर्पित करें, ताकि फार्मेसी के माध्यम से समाज में के जीवन में सकारात्मक परिवर्तन आ सके। इस अवसर पे मैं इस मंच के माध्यम से बीइंग ए कन्वेनर अपने पैट्रॉन और मेंटर प्रोफेसर आर के खार साहब को चरण वंदन करता हूं और उनके आशीर्वाद के लिए इनका सतत हमारे साथ खड़े रहने को अपनी कृतज्ञता व्यक्त करता हूं। आज के कार्यक्रम के चीफ गेस्ट डॉक्टर धीरेन्द्र सिंह जी, जो कि चेयरमैन एजुकेशनल रेगुलेशन कमेटी फार्मेसी काउंसिल ऑफ इंडिया हैं, वो अपने किसी व्यक्तिगत कारणों से अभी नहीं आ पाए हैं, जबकि आपकी सूचना के लिए बता दूं कि वो वर्तमान में दिल्ली में ही हैं और वो आने की उनकी पूरी संभावना है। साथ ही प्रेसिडेंट IPGA जो हमारे गेस्ट ऑफ एमिनेंस हैं, डॉक्टर अतुल नासा सर आपको भी प्रणाम है और इस कार्यक्रम में आपने अपना बहुमूल्य समय निकाला, इसके लिए धन्यवाद। साथ ही प्रोफेसर भूपेंद्र सिंह भूप सर जो आज हमारे एमिनेंट स्पीकर हैं, सर आपका भी स्वागत है। प्रोफेसर सरंजीत सर, आप भी अपना बहुमूल्य वक्त निकाल के आए, सर आपका भी स्वागत है। श्री राज वैद्य सर जो गोवा से चल के हमारे बीच में अपना आशीर्वाद देने के लिए आए हुए हैं, सर आपका भी स्वागत है। प्रोफेसर डॉक्टर अनिल कुमार शर्मा जी जो हमारे बीच में एमिल फार्मास्यूटिकल से हैं और वहाँ पे वर्तमान में वाइस प्रेसिडेंट का कार्यभार देख रहे हैं लंबे समय से। सर, आप भी अपना बहुमूल्य समय निकाल के आए, सर आपका भी स्वागत है। साथ ही डॉक्टर ऋचा दयारामनी रमानी मैम आप भी वक्त निकाल के अहमदाबाद से यहाँ तक आई हैं, आपका भी स्वागत है। साथ ही सभी जो हमारे देश के विभिन्न भागों से चल के आए हुए हमारे शिक्षक साथीगण हैं और हमारे जो बडिंग फार्मासिस्ट हैं, आप सबका भी बहुत बहुत स्वागत है। आपका विश्वास ही हमें इस तरह के कार्यक्रम के आयोजन के लिए प्रेरणा देता है। पुनः मैं आप सबको ये धन्यवाद देता हूं और आपका यहाँ आने के लिए दिल से स्वागत करता हूं। जय हिंद, जय भारत, जय फार्मेसी।
Thank you, sir, for explaining the role of pharma law in the field of pharmacy profession in India. फार्मा लॉ की जो भूमिका रही है फार्मेसी प्रोफेशन के बेटरमेंट के लिए, एक दो लोगों से जुड़ा हुआ ये कारवा पूरी भारत भर अब एक्सपांशन कर रहा है। फार्मा लॉ membership has also started and the expansion of pharma law is going to be there within next few days. So आपसे सबसे आह्वान है कि आप फार्मा लोग जुड़ जाएं। आप जिस स्टेट से आए हैं उसमें फार्मा लोग का एक्सपांशन करने में मदद करें, फार्मेसी प्रोफेशन के बेटरमेंट के लिए काम करें। थैंक यू डॉक्टर संतोष वर्मा सर फॉर योर kind explanation about the role of pharma law in the betterment of pharmacy profession. Now, ladies and gentlemen, now we will move to the inaugural notes of this National Pharma Summit 2025. As Santosh sir already told that our chief guest, Dr. Deependra Singh sir, he will join shortly within our program. Due to some technical issues or personal issues, he is going to join late. So now may I take this privilege to invite our eminent guest speaker, Dr. Atul Nasa sir. Sir, please come forward and guide us regarding the betterment of pharmacy profession. Dr. Atul Nasa sir.
Good morning. Very respected Professor R.K. Khar, my mentor and our guide, the eminent speakers for this summit, Professor Saranjit ji, Professor Bhupender Singh ji, Dr. Anil Sharma, Dr. Richa, Dr. Raj Vaidya, eminent academicians, Dr. Santani, Dr. Rakesh Somani, Professor Alok, Dr. Gupta, Dr. Jaybalan, and many others. I cannot name each and every one, but I welcome each and every member to this National Pharma Summit 2025 organized by Pharmalok. My sincere thanks to Pharmalok for inviting me on this Sunday morning to be with you and sparing my valuable thoughts regarding pharmacy profession. I tell you that 40 years of my journey, right from pharma industry, then into academics, then into regulations for 30 years, and then back to academics. It was a tough journey. It was a challengeable journey. But at the end of the day, it was a successful journey. Today, I am proudly a member of Drug Technical Advisory Board, DTAB. And recently, I have been nominated as an advisor on Union Public Service Commission, UPSC. Thanks to entire pharmacy profession and entire community that they have given a lot of support. But I always say, wherever I have worked, either in industry or in academic or in regulation or back to academics, I always say I am a pharmacist. And I am proud to be belonging to pharmacy profession, which has given us a lot. My memories goes back to the COVID time, pandemic time, the year 2020 and 2021, when the entire world has seen the time of pandemic, and it was the only pharmacist working in pharmaceutical industry, working in hospital pharmacy, community pharmacy, clinical pharmacy, regulations, academics, everybody joined hands to fight this pandemic, and we saved the entire country, and not only the entire country, the entire world. The development of two molecules, Covaxin and Covishield, it was not so easy job at the time of pandemic, and with the support of the office of DCGI, along with the support of ICMR, and along with the support of WHO Geneva, we got approved these two vaccines within the shorter duration of time, that is 8 months time, when the Covaxin and this Covishield were, developed. So thanks to all the pharmacists, and I say the pharmacists are the COVID warriors. The theme of today's Pharma Summit, transforming pharmacy institution, educations, research and public health. A very well chosen topic in the field of pharmacy profession. I also represent Pharmacy Council of India. Lot of challenges are there, but rest assured, our support to entire country is there from PCI. If you see overall system of our education, it is the quality education which it pays. And quality education means, अभी जब मैं बाहर आया तो खार साहब बैठे थे, कहने लगे ब्रेकफास्ट कीजिए. सबसे पहले मैंने पकोड़ा खाया, और जब पकोड़ा खाया तब पकोड़े से एक 5 वर्ड याद आए, 5 नाम याद आए. PAKORA, पकोड़ा means P stands for your pedagogy. आज अगर हमारी टीचिंग पेडागोगी परफेक्ट है, अकॉर्डिंग टू द curriculum, अकॉर्डिंग टू द requirement, definitely the students will be benefited. So we have to change our old concept of teaching, and experiential learning, that is much more important for the betterment of the students. And also P stands for placements. Remember, any institute and its recognition is not only by admissions. At the end of the day, it is the placements, how we are going to help the students for better future. Students हमारे यहाँ admission जरूर लेते हैं in different courses, whether it is Bachelor of Pharmacy or Master of Pharmacy or PharmD program or PhD program. But big question mark, what is the status of the placements? So our pedagogy as well as placement should be very strong, so that our university or our department or our college is recognized at national level, and we should be having a well recognition at different NIRF rankings and NAC levels. A stands for time has come of artificial intelligence. Artificial intelligence is playing a very important role in pharmaceutical industry and in the relevant field. So time has come We have to use artificial intelligence, but remember, artificial intelligence tools, whether it is ChatGPT or they cannot overrule the human mind. At the end of the day, it is the human mind which can take the help of artificial intelligence, but finally we have to work according to our strength and our knowledge. A stands for proper administration. Remember, success of any institute all depends upon the administration. If the administration is not perfect, we are a big failure, whatever the infrastructure, whatever the facilities we have. Stronger administration with positive attitude will definitely pay. This is second word, that is called A. Third is K. Updation, there is no end, there is no age, there is no limit. Even at this age, even at this particular point, if we want to update our knowledge, we have to come forward. And if we update our knowledge as a faculty member, as a teacher, as a resource person, definitely we are going to support and help the young budding minds and students. R. R stands for what is in the theme? Research and development. Remember, at MPharm level or at PG level or at doctorate level, we have seen the students submitting the pharma thesis, submitting the thesis for their PG programs without any publications. At least each and every faculty member should be motivated that in 1 year, there should be 2 research publications from each and every faculty, so that research should be strong. So until and unless research is not there, again system collapses. So we have to guide all the students for proper research and development, and automatically once research and development is there, the system moves forward. Another A stands for association with industries. Today there is a huge gap between the industry and academia. If we have to make the system very strong, we have to place the students in the relevant industries. There should be a reduce in the industry academia interaction, and that bonding is to be reduced. We have to tie up with all the relevant industry, whether it is a pharmaceutical industry or medical devices industry or diagnostic industry or cosmetic industry or any other relevant industry. That industry bonding is very important, and we have to see that all the students pursuing pharmacy as a career must be placed having some internship in particular industrial training program, and we must create an industry advisory board. Each and every pharmacy department must be having an industry advisory board. Like in my university, we have got 18 schools. In all the 18 schools, we have constituted IAB, and each IAB is having at least 10 to 15 members from relevant industry in their respective fields. Recently, we celebrated the World Pharmacist Day on 25th of September. And the theme of that World Pharmacist Day was Think Health, Think Pharmacy. So pharmacists are playing a very important role in healthcare system, and this is what our academicians are. We have to guide all the pharmacists for proper healthcare system. Recently, Indian Pharmacopoeia Commission celebrated the 5th National Pharmacovigilance Week on 17th of September, and the theme of that Pharmacovigilance Week was Your Safety Just a Click Away, Report Adverse Drug Reaction. अभी हमने मीडिया में देखा, due to some cough syrups, recent news, some children died, 11 children died in Tamil Nadu, in Rajasthan, in Madhya Pradesh, due to the presence of diethylene glycol in the cough syrup. Such a big challenge. So why this situation came, we have to understand as a pharmacist, and as a pharmacist, this is our moral duty to report any adverse drug reactions to the Office of Indian Pharmacopoeia Commission under Pharmacovigilance Program. Mission of, since I was a regulator, mission of any drug control department is to ensure safe, efficacious, and quality medicines to consumer, whether it is or it is education. Quality parameters plays an important and in all the fields. So we have to maintain the quality at all levels. 29th of September, we celebrated World Health Day. And the health day was don't miss a beat. Lifestyle disease like hypertension, like diabetic, and WHO has given a surprising data that 50% of the young generation is suffering from hypertension, from diabetic and so on. So this is the duty of the pharmacist to educate each and everyone to be away from this lifestyle disease and maintaining the health of each and everyone. And I will not take much time. As regarding to the role of Pharmacy Council of India, I know there are so many questions, there are so many issues, but as a EC member of Pharmacy Council of India, we are trying our level best to streamline each and everything, and Pharmacy Council of India is playing an important role by supporting faculty development programs, FDPs. So try to arrange as many as faculty development programs in your university, in your organizations, in your college with the support of Pharmacy Council of India. We are in a process of revision of curriculum, which is on the final stage. We are also encouraging the research and development by way of supporting publications, and almost the pharmacists are frontline health warriors. Again, I am repeating. They play an important role. Role of statutory bodies, whether it is Pharmacy Council of India or CDSCO or Indian Pharmacopoeia Commission or Department of Pharmaceuticals, including NPPA. Try to guide each and every student to regularly visit all these important websites of the important bodies of Government of India, which can definitely help in updation of your knowledge by going to the latest Gazette notification. Lastly, to conclude, I am happy to announce that 74th Indian Pharmaceutical Congress, Dr. Dipender Singh is not there, so I got a message from him that since he is the organizing secretary of 74th IPC, is going to be held on 19th, 20 and 21st December at Bangalore. So my request to all of you to support for this 74th IPC, which is going to be held at Bangalore. And again, I am happy to announce that 75th Indian Pharmaceutical Congress, 75th IPC, Platinum Jubilee year is going to be held in New Delhi by Indian Pharmacy Graduate Association. So we will see you all at Bangalore and definitely next year in Delhi. Thank you very much.
Thank you, Atul sir. Sir has explained the recipe of pakoda in terms of long form of pakoda. Definitely, sir, every pharmacy institution will follow this recipe of pakoda, and we will contribute for the quality education, outcome-based education, and we will increase the standards of pharmacy education in India. Thank you, Atul sir, for your valuable guidance and keynote. Now, ladies and gentlemen, I'm inviting the most respected personality in the pharmacy profession, our guide, our mentor, and always his support for Pharma Professor R.K. Khar sir. So I request sir, the patron of this National Pharma Summit 2025, sir, please give us your valuable guidance. Please, sir.
A very nice and a lovely good morning to all of you on this bright Sunday. thank you all for sparing your lovely and precious Sunday to various activities. And the three limbs, first and the foremost, is the pharmaceutical education, which is the fountainhead of other professional activities. Second limb is that of pharmaceutical industry, pharmaceutical research, creating scientists. And the third is pharmacy. And pharmacy is actually, as a matter of fact, the nucleus of pharmacy profession, which relates to the patient, which is patient-oriented pharmacy, whether it is in a hospital or in community pharmacy settings. Well, I think with that brief, our theme which has been set is addressing to all these three different important prerequisite requirements of our profession. Well, the chief guest of this function, Professor Dr. Dipinderji, has not been able to come due to some personal reasons. We are very thankful to him for having accepted our invitation, and he will be coming shortly after some time. Then we have here also with us very different eminent guests of eminence. Professor Milind Umekar, who has also not been able to come due to his personal reasons. And we have none other than Dr. Atul Nasa, who is President of Indian Pharmaceutical Graduates Association, and he is also a Pro-Vice Chancellor of SGT University, Gurgaon, Delhi NCR, and he doesn't belong to IPGA, I think so. He belongs to all the professions, all the associations. He is a man of the masses, and he is a true leader. I have seen him growing over the years. I am very, very proud of this gentleman. Thank you, Dr. Nasa, for sparing a lovely Sunday today here with us. Then we also would also have loved to have Dr. R.N. Gupta, President of Indian Pharmaceutical Associations. Again, there has been some emergency that he is not attending. Then we also have with us today various different distinguished and eminent speakers, amongst them Dr. Professor Saranjit Singh, well known to all of you. He has been the former dean at Naipur, Mohali, and a very, very popular speaker at national and international level, well known and consistent in how he has grown in his profession over the years by having his specific goals and a passion for something. Then we have yet another very, very good scientist with us today. I'm very proud that another very good friend of mine, Dr. Bhupinder Singh Bhup, who is the former dean. He is the former chairman of University Institute of Pharmaceutical Sciences, Punjab University, Chandigarh. A very, very good scientist and a very eminent, speaker, and a well-known pharmaceutical professional and very popular person around in the country and abroad. We also have with us Professor Richa Daya Ramani. She is a scientist at Center of Excellence Medical Division, Medical Devices Division at Naipur, Mohali. I extend my thanks to her for coming over here and sparing this lovely Sunday with us. Then again, our own here mentor and friend, Dr. Anil Sharma, who is the Vice President of ML Pharmaceuticals. He always adds new things. He talks about how we can do out-of-box things with the use of traditional medicines and our wealth and the knowledge which is present in our country and make new pharmaceutical products for the masses. Then of course, the patient-oriented pharmacy part of our profession, the pharmacy, what I said, by in terms of proper deliberation by Shri Raj Vaidya. Many of you may know that Raj Vaidya is a very leading community pharmacist in our country, and he has done a lot of work for the last 10 years for bringing community pharmacy to the level as well. And now he is the observer of International Pharmaceutical Federation Community Pharmacy Division. We are very proud to have you, sir. Then I want to make a background, and then I'll give you some observations, Then we also have our, I think I want to say about Amit Jha, who is the coordinator of Pharmalok, chief coordinator of Team Pharmalok, they are calling it. And I'm also thankful to all the distinguished guests. I won't be able to name each and every one of you. There are many senior scientists, many senior academicians, and other experts who are here, and the ladies and gentlemen. With this brief, I think I should now come to what I want to say. Really, I am extremely pleased to be here today in this lovely ambience on the occasion of Pharmalok Summit 2025, which is being organized by Pharmalok team. Mr. Amit Jha and his dedicated team have done an excellent job of being able to create this lovely, wonderful platform with this very beautiful ambience where so many pharmacy experts and professionals from various streams and from across the country have been able to come here and deliberate today and to come out with certain important recommendations for the development of our profession and to be able to face the challenges of future. I have been in fact observing this team for quite some time. Team Pharmalok, they have been working really very tirelessly for this conference this last few months. And during, I'm recalling, Dr. Nasa also recalled COVID. I will also recall COVID in the different sense, I recall COVID with what we called as cytokine storm. एक तूफान सा आ गया था, inflammatory storm in our bodies. But this time I saw the phenomena was with opposite outcomes. We could see the social media storm this time. This time with the focused and the well-planned activities of Team Pharmalok. If you would open your social media any day in last 1 month or 2 months, कोई भी चीज़ आप खोलिए, WhatsApp खोलिए, Facebook खोलिए, अदर जितने भी आपके पास social media हैं, you will always come up with some or the other activity being organized by Pharmalok. It's so interesting, so lovely. There were so many brainstorming sessions which I also had opportunity to attend on various important themes on different occasions and on different occasions of which were relevant to pharmacy profession. And like of Pharmalok keep very good teaching and learning programs happening regularly for the benefit of the pharmacy professionals, These activities are in fact, but they assume the form of a storm over these last couple of months, and we place on records the appreciation to all the team members as well as the distinguished Pharmalok mentors and the learned experts of various fields from across the country for participation in these programs. It was an example and really an excellent example of teamwork and an overwhelming affirmation of what we call as, in the present contemporary sense, as connecting the dots. I think the team has an excellent, skill of connecting with different people, and they have put a slogan here as Pharma connecting by heart, and I would connecting by heart as well as mind. Well, with these words, I would like to say that the learned experts today afternoon, after lunch, are going to deliberate on various different topics, so I will not go into the details or any science or scientific knowledge, but I'm very sure that we'll certainly have, with this such eminent faculty we have had with us, we are going to have very, very good takeaways after this conference. But before all that, I would like to give, as an ordinary pharmacy person, some of my important observations for the conference. First and the foremost, I said already and told you about the International Pharmaceutical Federation. I was going through the website and I saw that they have chalked a very, very wonderful program, what they call as the developmental goals. They are the developmental goals for the whole profession in all these 3 dimensions which I mentioned earlier on. And I think we have to also look into those possibilities. I will only name a couple of these things which have impressed me. Dr. Nasa tells that we are already on way to, revise the syllabus. Sir, in FIP developmental goals, they are mentioning that they would like to encourage the pharmacy institutions to have a specialization in the pre-final and final year. I think you are looking after that. Then another important thing which is of great concern to us, every country is different, and I think every state government is different. Well, do you think we are catering to the needs of the population? Because there is a very important mention in FIP about the relevance of, contribution of the pharmacist to the healthcare. And Dr. Nasa has already snatched my words. He has confronted with more than 50% of the diseases which are, and in our country as well, they are related to lifestyle, and we call them as NCDs. You see, are we prepared for it? Is there any syllabus topic in it? Are we preparing the pharmacist to tell the people how to maintain their health, how to improve their lifestyle, how to prevent these diseases which are happening and which can be prevented? I am telling you with authority, I am telling you with my personal experience that you can certainly do it. So our attention should be to attend to these things very effectively. Then another important thing which I want to mention, that times have changed. It is the cyber stage now. Knowledge is available, information is available. So it's very, very important that we have to shift from knowledge-focused model to a student-focused model. Well, what I mean by student-focused model is that here you will have to integrate 3 important components. Your own subject, whether it is patient pharmacy, whether it is industrial pharmacy, like say patient pharmacy is going to precision medicine. So it is integrating with AI in that way. Industrial pharmacy, you have so many things already, AI is taking its part. Then another third important thing, it is very important, to have practical and actual, real experiences, real world experiences to the students to be given, rather than giving the long and long PowerPoint presentations, which that knowledge is already available in the website or in the Google or wherever you call it, So this is very important, We have to understand how we can change. Is there anything to be done, and how and what is to be required that needs to be noted. Then another important thing where we have been lacking, we have been talking about industry, academia collaboration. Now we are talking about mentoring and collaborations. It's important to create such a system where there are people available, knowledge. You have to create that mentor system, as well as collaborations with the industry. We have not done very good in this. There are definitely many gray areas. There are many gray areas. Many institutions do collaborate effectively with definite outcomes. Remains to be done. I would like to tell to all the audience that even our SMSE can play a very important writing and interface, personal experience, which is going to tell us so many things. The next important thing which I like to highlight is now the time has come. NASA has also said it has to be student-centric learning. Friends, how I taught, how I learned is obsolete, completely obsolete. I was telling the other man yesterday that AI is taking over. There will be no need of lecturers. There will be no need of assistant professors after 10 years if we don't change ourselves, So friends, shift the focus to, it has to shift from, it has where to go, become a student-centric learning has to take place, and the shift has to take from teacher-focused to student-focused, what we call as smart learning. This is what is referred to as, and we emphasize here to initiate intuition, to initiate critical thinking, to initiate spirit of inquiry into the students. जब उनमें कोई प्रॉब्लम सॉल्विंग की क्षमता होगी तभी वो आगे इंडस्ट्री में या हॉस्पिटल में कामयाब हो सकते हैं. अगर वो सोच नहीं सकते अच्छी तरह से, if they are not having the capabilities of having various thinking and intuition and imagination, they will not be successful. They should be able to solve small problems and large problems from time to time wherever they are placed. Then, you see, this is the time of continuous learning. What I learned 1 year back is already obsolete. You have to learn everything, something new. Your performance, your skills have to be better and better. For that you need to self-assess yourself. You need to find out by your own self as to what you have progressed in last 1 year. What is the new skill you have gained? Which is the new artificial intelligence tool which you have been able to integrate your professional requirements. This all depends on you. Unless and until you are able to do it, you have to do that self-evaluation, problem solving, and critical thinking all together. This will lead to intellectual development. Your IQ will also go up, and if you are a team worker, your EQ will also go up, and also your intuitive quotient will go up. Only then you will be able to integrate with the modern cyber age of AI. Then lastly, I have a suggestion to the regulatory authorities. I am very fortunate that Dr. Nasa is here. He has been in the profession for so long time. We in the elderly age group, I feel very bad when ethics is compromised, when integrity is compromised. Sir, it's very important for all of us to see that there are no virtual institutions. There are no institutions where there is no teaching happening, where there are teachers coming once in a month. मुझे बहुत दुख होता है इससे. I feel very bad. I don't know how to do it. PCI is trying to have biometric attendance, many things they are doing. See what they can do, you know. If somebody is bent on doing mischief, you know, I think, you know, there are also many diploma institutions, sir, in